Is Eric, you want to weigh in there?
No, I don't know, 83%.
83% of doctors nationwide are threatening to quit?
It sounds rather extraordinary, but what I will tell you, and what anybody can see anecdotally, is talk to doctors. This system, that's the problem with the system, and what's been described as what's going on in Washington, D.C. right now, is we keep arguing about everything except the basic premise that our medical system, it doesn't work here. It doesn't work.
Is this going to make it work better, though?
No, it's not going to make it work better. I have yet to see anything or any dialogue about something that will make it. I know it's going to be expensive. I know that we don't have money right now, but I know that the doctors don't make enough money, and a lot of them have to take second jobs or don't want to be doctors anymore. And I know that patients aren't getting, the right type of medical attention, and the insurance companies can or can't make money depending on who you believe, but it seems to me like it's broken all the way around.
Well, thank you for that deeply pessimistic view that it doesn't work now and it's not going to work.
You know what? I got to tell you, I've been inside of that system for 20 years, and it just doesn't work. But you know what? Nobody likes going to the Department of Motor Vehicles for the exact reason that you described. But you can go to any health program in this country right now and feel about the same. And if your mom's sick or your wife's sick,
not mine. Not mine. I pay. You know what? My insurance rates went up over 50%, and the reason being is I got a nice form letter from Virginia Blue Cross Blue Shield. You know what they told me? We have to raise the cost in anticipation of the rising cost of Obamacare. That was there. It hasn't even been in effect yet, and I'm being hit with a 50% penalty on something that the president promised me I would be able to afford.
Yeah, I guess all I'm saying is that if you have a chronically sick loved one in your family, it does not matter how successful you are in this country. We're ranked 26 in the world. I don't know how that's even possible that we're the United States of America and we're ranked so low. The medical care in this country for most chronically ill or terminally ill people is very hurting, and it has been for a long time, and there's nothing in the debate that addresses that.
Brad?
Well, Eric's right. And what we should be doing is having market-based solutions instead of creating more government. The government health care we provide now is substandard, and it's going broke. Enough said. We know what we've got, and we know what we're getting. And we don't like it. And the fact is that the Supreme Court may be the court of last resort, but they're not the court of public opinion. And the people are going to have their say on Election Day. Either they want Obamacare or they don't. Elect the Republicans, and we're going to get rid of it, and we're going to go back to a market-based solution. And then we're also going to fix the entitlements which are unsustainable at their current rate, Medicare, Medicaid, and Social Security.
All right, it's a debate we will have many times on this program as we approach November, and this becomes an issue in the general election. Thank you both to the panel. Brad Blakeman, former Deputy Assistant President George W. Bush in D.C., and Eric Yaverbaum, Associate Publisher of Social Media Mags, here in the studio. Thank you very much, Eric. Good to see you.
Always great to be here.